The mission of the Rural Health Group is what gets me up every morning. I really believe that healthcare is everyone's right, and the Community Health Center movement really focuses on guaranteeing that right for every individual.
I think the personal interest that the doctors and the staff take in the patients, you're not just somebody who comes through the door and goes out again.
We have to deal with the issues around nutrition. We have to deal with the issues around exercise. We have to deal with empowering patients. And so the whole point of community-oriented primary care and doing community health centers is to combine public health with primary care, and I think it's a very powerful model.
The part that really touches my heart is serving the underserved, meeting the needs of people who don't really have medical care or medical coverage, being able to serve people who don't have health care coverage.
It's just such a vital operation to the people of this area.
I think one of our greatest challenges is trying to serve the most people who have the least with increasingly fewer resources.
Dr. Howard does my blood pressure on my own.
I think that Rural Health Group has made a difference in our patients' lives, and that it's enabled them to receive quality health care, which is our #1 priority, is that it is quality health care.
We aren't about making money, we're about changing people's lives one person at a time.
Community health centers are the only healthcare system controlled in partnership with patients. Every federally qualified health center, FQHC as these centers are now known, is governed by a community board with a patient majority, a patient democracy. The beauty of this system, which is unique in America's healthcare landscape, is that patients do not just pay for their healthcare. They also have a say in how their healthcare is delivered through their patient representatives on the center's governing board.
What really has brought healthcare forward in this country is not medicines, it's vaccination and public health. And the next big step forward in terms of chronic disease management is dealing with the community. We have to deal with the issues around nutrition. We have to deal with the issues around exercise. We have to deal with empowering patients. And we can't do that on a single one-on-one patient. And so the whole point of community-oriented primary care and doing community health centers is to combine public health with primary care. And I think it's a very powerful model that needs to be expanded beyond just the uninsured and poor. It really needs to be expanded into the whole country.
I grew up in this area, so it means a lot, that I leave the community and able to come back.
A lot of underserved patients who don't have the usual resources of insurance, money, location, transportation, those things that a lot of people take for granted. And being with this organization, you can serve and reach some of those people.
A lot of times it just means an extra 2 minutes in the room speaking with the patient, because there's so many more things going on in their life besides their health care.
I think my workday I regard more as enjoyment than I do of a challenge.
Certainly there's still a lot of people out there who are not getting the care that they need.
We always try to go above and beyond where we need to, where we have to be, in order to make sure that everyone in the community is served.
It's not just care, it's quality care.
It's not like any other job. You go home at night and you may be exhausted, but you know you've done something good.